We are going to discuss today the healthcare in Skyfall Challenge, and I am particularly glad to welcome my guest speaker, Rhym Abdennbi, who is Doctor of Pharmacy and international healthcare executive passionate about the science and innovative solutions. Hello, Rhym.
Hello, good evening.
Thank you very much for accepting my invitation and be able to join us.
Well, thank you for inviting me. I'm very happy to be here with you guys.
Welcome. And I let you the floor. Please introduce yourself, and we will start with the first question. Why do we call this tremendous challenge in front of healthcare Skyfall?
So, yeah, thank you very much, Madina. So my name is Rhym Abdennbi. I am a doctor of pharmacy. I've been working in the healthcare industry as a pharmaceutical executive for the last 15 years. I worked mainly as a marketeer, so interacting with physicians, trying to find solutions to make our drugs more attractive in various arenas, from orphan drugs to mass market drugs. And definitely one thing that struck me in this crisis, so obviously you guys understand that we're talking about the healthcare crisis we are still going through, are several things. Literally, the sky fell on us. I think the first thing is because it was almost overnight. Overnight, we discovered that we will have to go in confinement or lockdown. But moreover, I think we can call this a Skyfall crisis because nobody was set aside. It touched everybody. You know, whether you are rich or poor, whether you have influence or not, whether you are political or not, it had nothing to do with it. So it's universal, and it really is something new because I'm from a generation that didn't know the war. Most of us didn't know the war. And most of us didn't know these big epidemics and these situations that really change completely your life. The other thing that makes it a Skyfall challenge is that it is a challenge because it's silent. So you don't see it. Usually when you have an epidemic, you see people cough, or they have a fever, or they have symptoms, some kind of symptoms. Something is happening. Same thing when a difficult situation arises, it has symptoms. In this situation, you can literally be seated beside somebody who is infecting you right now, and you don't even know it. You cannot know it. It's completely transparent. It's like a poison, a silent poison that is poisoning you without you knowing. The next thing that makes it really difficult and challenging is that we kind of know when it started. There's still a lot of discussion, especially from the scientific community, about the real date when this all started and how it started. I will not elaborate on the different polemics around, when it came from. But the most difficult thing for us human beings is that we cannot project ourselves. We don't know when this will be over. We don't know if it will be over. We don't know how we will stop it. And we don't know how to project ourselves in this new world. A lot of people now are talking about the world before and the world after. A lot of people think, and I'm part of those people, that the life as we knew it will no longer be, that we will have to evolve the way we live. And I think this is why it makes it also an unheard of kind of challenge. One thing that is really striking for me as a French citizen, because I'm French and I live in France, is that it does impact relationships in the most important way. We had to stop social interactions, even with our loved ones. So the only ones that we were allowed to interact with are the people with whom we live. And sometimes also with those with whom we live, if it represented too much of a risk, we had to move away from them. This is new. I mean, except maybe for the pests, Yersinia pestis, we never knew that, or maybe some very infectious diseases that our world with the vaccines and the vaccination and antibacterials moved away from. So this is really, really striking. And again, we don't know when we will be able to have, again, you know, Sunday lunches with our parents and family. This is really something that is striking. And in France, people are talking about how are we going to kiss each other again. You know, in France, the custom is when you say hello is to kiss people on the cheek. We don't know if we will be able to maintain that. You know, this is the core of the French culture. So it's very strong. And last, and I guess to summarize it's the first time that we have so many unpredictable factors coming all together. Mm-hmm. There are so many variables moving at the same time. Our brain cannot process all the possible scenarios at once. And this makes it highly stressful.
Same vécu, if we can say it in French, which I had during this period of time. And there is profound transformation from the healthcare standpoint also, because we are facing quite big limits of the healthcare as the system and as an industry there. So transformation is not something new for this industry. We went few times and every day through those transformations. There is a big difference now. And what is this big difference now in this sanitary crisis? What's the difference, the main piece of this challenge from your standpoint?
Yeah, I used to work at a company that was saying that the only constant in life was change. I have to admit that it's absolutely true, but I think everybody wants to say that too much is too much. So this time is too much of a change. So no, definitely. Several things were touched from an industry perspective. I guess the paradigm of interactions is shifting. So it's shifting for the industry. So during this crisis, all the industry had to stop going to see physicians. That's the first thing. Obviously, they did not have time for the industry. And we became a vector of the infection as well, obviously. So we had to stop cold turkey from a day to the other. We stopped all interactions with the physicians. The other thing is the only interactions physicians had with their patients were the ones related to the infection management. So the patients who did not have an issue with the infection was set aside for some time for their own sake.
Yeah.
So that changed completely the way we look at healthcare, because for the first time, there was a 100% priority given to one particular topic, which was this particular infection. And that came over 24 hours, basically. And we started looking at our healthcare system be put under more and more and more pressure, which put everybody under stress of, okay, will our healthcare system go through it? How are we going to go through this crisis from a healthcare system perspective? The industry then went back and went to the back office, I should say, and our industry was put to high levels of stress as well, because the side effect of what happened in the forefront in the ICUs is the high need for very particular drugs that we are absolutely not used to produce in such volumes. Same with the respirators. Everybody heard about the respirators that were not so many. And I mean, we have as many respirators and we produce as many respirators as we have ICU specialists. And we had to repurpose some of our manufacturers and some of our factories to produce some of the drugs that we were in high need and some of the machines that we were in high need as well. And that, I mean, in pharma, as many other industries, it's a highly regulated industry, and this one touches human beings. So you don't want to do, you know, we're not building a car, it goes into somebody's body. So it takes time. We were able to shorten a lot of timelines. When you look at the vaccination and the fast track that vaccines is taking, it's really amazing and impressive. The researchers are doing their best, and companies put a lot of effort in really leaning the management for delivering. Same thing with some clinical trials, with the discovery clinical trial, for example. But all this put a lot of pressure on an industry that is not so used to manage that. I mean, we know how to manage crisis, but not so many parameters at once like this. And I think we're doing quite okay. However, the caveat of that is that the people who were not there on the forefront working on these questions were a little bit set on the side and started asking, you know, what will be the consequences of this situation? And I think that's where really we are focusing right now on how do we change the paradigm? How do we still continue to bring value to our customers, physicians, patients, the healthcare system, when the interactions, the communication mode is completely changing? And we are rediscovering that actually we do have some tools that can be used. We are rediscovering that actually face-to-face is not anymore the alpha and the omega. We will not be able to meet face-to-face for some time. Those of us working with hospital physicians will have to refrain from going to see them. For office-based physicians, well, maybe it will be the same because it represents an infectious risk to call to the physician. So we need to change that. We also look at conferences, congresses and events that the industry or scientific societies organize. A lot of these have been canceled, and this is the most interesting part, they have been transformed. And I think that's really what's interesting in this crisis is to what extent we become creative in finding new solutions. The need for interaction remains, the need for training remains. What is changing is the way we do it. And we're rediscovering digital. We are rediscovering all the tools that digital can provide. And we are rediscovering that communication is not only face-to-face. And it also forces us to go to research and to go to follow up on the research and trying to find innovative solutions.
It means that you notice the new customer behaviors and the and emergence of the new needs which were not before there. And even if digital space was developed and already used, we had tremendous amount of platforms and applications and connected objects and medical devices. What's the difference is now, how these emerged needs will be answered in the new way of interaction?
Yeah, absolutely. I think the needs have not changed really. It's the way we answer the needs that have to change. So as we said earlier, this situation happened overnight. So overnight, the needs did not go away. So we needed to embrace the digital solutions overnight. Most of us overnight became remote workers, from home workers, and had to learn how to use Zoom and to learn how to use their phones and work on their computers and actually connect on Netflix or Amazon Prime or whatever to keep the kids busy. So overnight, everybody became a digital savvy person. We have to. I mean, there is no solution. I think what's changing is that we are discovering that digital is an ally. Some people see computers as evil. Actually, computers can help you connect with your family, and in our case, help you answer to a need. So a physician needs, I don't know, a drug, it needs a counseling, it needs an advice. He can still reach his contacts in the industry through the computer. He can send an email, we can set a telecom like this, we can send a Zoom. So I think the way to reach out and interact is changing. And it's again the answer that is changing. The other thing that is really different is that we are accepting that we can interact with the barrier. So when you go to a pharmacist or even you go to buy your bread, now everybody has this plexiglass protecting, from the virus. And so without even noticing, we are introducing barriers with the people who we interact with. Everybody accepts that because the reason is clear for everyone and it's obvious. It's becoming the same with digital, because by default, we understand that to be safe, we have to interact from a distance. This is really new because, again, interacting face-to-face was the alpha and the omega. This is not the case anymore. So potentially, the alpha and the omega would be this kind of interaction, because for a long time, we will remain with our masks, which is also, so we will remain with people that we don't see or through a glass, which will modify as well the way we interact with the people.
Does it mean that we need different skills for interaction? Does it mean that we have to learn how to express the empathy, the touch, which will not be there, and physical exam anymore? There will not be anymore. I mean, there is no ritual, even ritual of physical exam now in the patient and doctor interaction that will touch other interactions as well. I mean, there's perhaps an imposing need of learn, especially for certain generations, how to make it more human.
It's a great question. I think definitely the touch, I mean, empathetic people are the ones who are suffering first.
Yeah, I can confirm.
So yeah, definitely. So empathetic people will suffer from that, because the touch is something that you cannot simulate over a computer. That's for sure. In terms of skills, I think we are coming to a time where a lot of these tools are becoming easier and easier to interact with. So a lot of effort are put, and I think a lot of effort will be put towards making these tools easier and easier to be used, or to put their help for you to be able to use them. So I'm quite confident that, my mom will be able to connect on Zoom or on FaceTime or on, whatever platform there is to be able to interact. I think the point around the medical exam and the ritual behind that, which we know partly is curative, that is something I think that physicians should be, and healthcare professionals should be trained on, because that's something that we do not want to lose. The impact of a physician, I remember even when I was a kid, I was coughing, I would go to the doctor and cough is gone, just seeing it's the white coat effect. It's very well known as a placebo effect. So I think we want to keep that. It's really powerful. I think this is a skill that you can learn. You can still ritualize the interaction with your counterpart.
That is an excellent idea in sense of, sorry, interrupting, Rhym, where my first consultation, I've noticed it because patients also, they have this barrier. And of course, certain rituals and even exams, for example, when you're doing the examining women for the breast cancer. So some gests and some examinations are absolutely necessary to be there. And it seems like it's simple thing, but it can save lives.
Absolutely.
Sometimes, and we can't avoid to have that. Where I agree also is that we need to rethink of way we are talking to patients, or way we are entering the consultation, what kind of gest, what kind of prepared words we should have there employed to install the trust relationship when we are doing this virtually.
Yes.
So, okay, and then
but actually bouncing
relationship,
bouncing on what you're saying, one thing that is really critical is that all these tools allow you to record what's happening. So
there is a large amount of tools, yes.
You know, so most of them you can actually record the interaction for whatever purpose. So I think this will modify the trust. You were talking about trust. I think this is really important. You have access live to all kinds of resources. So these tools actually allow you to go to your physician and show him the latest clinical trial that obviously half the people don't understand, but still they will bring it to their physician saying, doctor, I have cancer. Look, I have the documentation. You can record all that. And it poses as well the question around privacy and what level of exposure to our private data we are willing to accept. Today, when you look at all the laws that have been passed, we are able to accept quite a high level of exposure. Are we able to accept that in the long run? That's a question. I think for now, a lot of people are not even aware of how exposed we are. I don't know if the governments and if the bodies, the regulators are aware of that.
Yes,
this is something that we
space
need to think of. Yeah, it's in the open space. So, you know, how are we going to do that? I think the good thing is that we are also able to share a lot of data. That's the positive side. When you look at the way we got the genome coding from China, all the data coming from the other countries, how we were able to, you know, exchange the protocols, etc. Actually, this is a good thing because I think that's how as well we learned how to manage this disease, how to take care better and better of the patients that were in the ICUs. Every day we had something new coming, a physician saying, look, be careful, don't do it this way, don't use anti-inflammatories in the start, use them at the end, etc. You know, so to some extent, this exposure is okay. However, we need to have some kind of control so that it doesn't become used for, you know, it doesn't fall into the bad hands. I would say.
Yeah, we all know that sometimes to get the result of the clinical trial takes quite a long way and run to their scientific publication or article. It can be from the fastest one online, it was about 3-6 months, and for the nice journal with peer review and so on, it could take years. So today, this is shifted. This is something which is accepted by scientific society, and they're able to publish quicker, faster, exchange faster, and have also this collective intelligence work to be able to value and to analyze the scientific information properly. So tremendously, WHO also saw their impact and willingness of this centralized efforts of collaboration, which is really, I mean, it's a hope for the future. I mean, in the industry where we're used to be very competitive, today we can't continue in the same way of work. So what kind of things we're going to stop doing from your point of view from now, and we start to do different? So one example is data sharing.
Yeah, the other thing we can add to that is probably competing for resources. So one of the key learning adds from this crisis, we rediscovered that we put, for the sake of the economy, we put all our eggs in one basket, and everybody buys from China, and China is the store of the world. But when China is down, well, everybody's down. And then we rediscovered as well that the one countries who had manufacturers or factories that were able to produce, they prioritized their own market. So I think this is something that we will bring to the next level. Most countries are rethinking about what's the value instead of what's the price and what's the cost. So I think we will move away from a fully priced model to a valued model, which is what the pharma industry in particular has been trying to move towards that direction for a long time now, with some success in some countries. For pharma, they are discussing about having factories based in Europe at least, that are mutualized and allow to have plan Bs. So not only one plant, but have different plants, so that if one falls, you have the other ones. And I think, I think we do have a lot of learnings, and positive ones actually are coming out of this situation. We are rediscovering resilience. We are rediscovering that we can adapt in the short, mid, and long term. In the short term, we were able to repurpose a lot of our production factories. When you look at this masks question, for example, when you look at Dior and Yves Saint Laurent doing masks, luxury masks, and when you look at, I talk about France because these are the examples that I know best. When you look at this vacuum cleaner company building respirators, or Airbus building respirators,
or Decathlon.
Or Decathlon building respirators. This is what I call resilience in the short run. We are able to find short-term solutions, and this is very comforting. In the mid and long term, I think we are envisioning that our society will have to adapt. Some jobs will disappear, some tasks will also disappear, and that's okay, because the other thing that we are discovering is that there is a greater good. So for the sake of others, I have to refrain my personal interest. This is really new for the Occident, for Europe, especially or for rich countries. Especially, when you look at all what has been done, the lockdown, I am not sick. Potentially, even if I get sick, I will not die. But I think the game changer is that I can make my parents sick. I can make somebody's grandmother sick, and she can die. So I think we are rediscovering that we are connected. So I think this is something that we will start again to do, is to not think about ourselves only, a little bit, maybe being a little bit less selfish, and having a look at the greater good. This is something everybody forgot. It's like, people rushing to the supermarket to buy toilet paper without, buying all the toilet paper. I don't care about my neighbor. Hopefully, we will rediscover that this is not really a smart way to behave. Collaborating is the key for the industry.
Yeah.
I think everybody sees that now.
Well, what will be the difference in the future way of collaboration between?
So I think it's in the same. Yeah, it's a bit in the same group of ideas. I think we will move away from a personal gain to the greater good. So we will move away from the personal success to the group success. Here, the success will be to have a vaccine for everybody. I know several companies are working in parallel, but the data, the original data, was shared with everybody. So,
absolutely,
each company has their own ways of doing things, and they have their own innovative solutions. And I don't think we want one way. So I don't necessarily see everybody working together all the time. But I think everybody will be happy with the first vaccine coming out, with the second vaccine coming out, because the more the merrier. I think that's a little bit the mindset. Hopefully that's what I would like to see. The other thing is the industry collaborating with the public system. So
Yes.
that's the other thing. We have primary researchers, the one who discover, how the bacteria and the viruses work. This is work that usually is not done in the industry because it's too preliminary and we cannot necessarily scale it up to find a drug. But we have great researchers in universities and med schools, etc. And that is definitely could work really well with the private sector. We saw it with hospitals collaborating together, private and public. We also saw it, it has been the case for ages between the industry and the healthcare system and the hospitals and the med schools, etc. I think this is something that will increase because we need this original data, this fundamental data research that the industry is not willing to do, or it doesn't have the time or money, and it will work more and more with the private sector to scale it up to find solutions. And I think we will have to learn to do that in a different way. So again, the other thing that will change is the way we interact. So to be able to do that, if you want to work, you're based in London and you want to work with someone based in New Zealand, you cannot just pick up your phone. Yeah. Time difference, etc. But they still have valuable information you want to access. So I think what will be modified and changing is the way we work, the way, again, we use the networks, and we use the technology. The technology will probably be the cornerstone if we want to move on. So the ones who do not embrace the technology will lose. Definitely.
Especially everything what is around artificial intelligence, blockchains, data mining. This is a big stuff of innovation, which is actually already there.
Yeah.
But in the coming years, will be taking bigger space and bigger dimension.
Absolutely. For example, if I talk about the blockchain, just for a second, this is an amazing way to make data encrypted. So we were talking earlier about the data being exposed. This is a way to make sure that nobody can actually access the data, that you don't want them to access the data. This will be critical if we don't want the bad people to access this data and make it, corrupted, basically. So yeah, absolutely.
And this is going to change also the way we are doing clinical studies. So we went globally for clinical studies. We had multicentric research, which is extremely powerful thing at the end of the day when it's done in collaboration.
Absolutely.
And good willingness and mindset behind.
Especially the goodwill, because I think one of the key challenges we have with the clinical trials is the paperwork hurdle that you have to work with. Some countries are easier to deal with than others. Again, with digital, now clinical trials can be on your cell phone. You can have everything on your cell phone. You don't need paper. It can be really streamlined. The same thing with how the data is managed. It can shorten the times of analysis. It can make it more efficient. It can make it also less prone to defects and to mistakes. On the other side, it means that we will need to change, and that's again the same recurrence. We will need to be resilient. But definitely, I think this will make it more. It will make us more efficient. I'm confident on that.
And what will be the difference, Rhym, in all these technologies? What will make the difference? I mean, you have mentioned already, we were talking about innovations, but the clue of the innovation is some capacities of reinventing and creating.
I think we will have to be creative. What will make a difference is our ability to embrace this fast. So as I said earlier, I believe that the ones who push back on technology will not make it, to be honest. You need to embrace it, and you need to be, we have all the tools, you said that earlier, we have a lot of tools, now we need to be creative. So what will make the difference is, yes, our ability to embrace it, number one, and number two, our ability to be creative about the existing tools. So how do we take what we have to put it at the service of what we want to achieve? In my opinion, creativity will be the key.
Creativity is something which is very rare capacity of humans, and especially I mean, I'm talking more about the traditional organizations, and in traditional organizations where in certain way of we have a certain way of work, and sometimes creativity was not so welcome. But today it seems like it became the main and huge difference, which can be revalued in such rigid and very regulated systems like healthcare industry.
Yeah, you know, what's funny is that you're creative when you're the first one to do it, and then you're not creative anymore because everybody's doing it, and then it becomes the norm. So I guess to be able to move on, some of us will have to be creative for the others. If I look at the recent projects I put in place, I remember myself 3 months ago saying, we need to go digital. We absolutely need to go digital from a face-to-face perspective. We will have to move away from a face-to-face model, meaning our reps going to the physicians. I said, we absolutely need at least some of these interactions to be made remotely. And I remember my comex looking at me saying, well, Rhym, you're delirious. This will never happen. You know, physicians want to see their reps. They have relationships with them. You know, they need to talk to them. They need to go with them to congresses, etc. Well, guess what? 2 weeks later, we are in lockdown, and the only way you can interact with the physician is through something like this platform or your cell phone. Well, guess what? It works, and it is working. Because the need is still there. The way you address it is the critical thing that you will need
to. But also, relationship will be different. I mean, it's going to change somewhere.
Yeah. Definitely. I think that's one of the downsides. Maybe is that the relationships will become more difficult to build because you will be able to spend less time face to face with people. And I still believe that you cannot build a relationship completely virtually. I mean, ask all the people who are going on Tinder. You don't build a relationship by texting someone. So that's a no-brainer. It also will limit probably our agility. So the fact that we are talking remotely, you're not there with the person, it's a filter. No matter what, it's a barrier. So you cannot anticipate, you cannot read the person you're talking to as well as if you are in front of them. So that will limit our ability to build strong relationships. And it means that you will need more time to acquire the trust. We're talking about trust, especially when it comes to a patient with his physician. It will be longer. On the other hand, when you look at the tools that have been developed for the physician-patient interaction, you get a rating on, you know, the interaction. So we will find new ways of building trust with people. Maybe it will not be only on a one-on-one interaction. It will be a ranking that you will get, like when you go to the restaurant. It will be on the long run as well. You know, how fast you can get to the physician. Does he remember you from a time to another? Does he treat you well? Does he follow up? You know, again, creativity. Creativity will be our key, I believe.
So it works for doctors also. We have to be creative.
Yes.
Because relationship with patients is something for the long run, actually.
Yes.
It's like in couple. I mean,
yeah.
Sometimes there is conflict situations, and you're not always to be nice and welcome and reply to all needs. There's some need of challenge sometimes, and then
Yes.
Honestly, when patient comes back, that means that you have achieved this trust.
Exactly.
So, Rhym, another question is around we touched innovation, we touched technology, we touched relationship aspects in healthcare industry, supply chains, and data sharing, clinical research. How about the policy frames all around that? So there's some big need to reframe stuff, including, for example, market access we had before, how it's going to change now, the access to treatment. Actually, if tomorrow we'll have vaccine 1, 2, 3, 4 candidates, how we're going to make it accessible and achieve the needed coverage for efficacy. So there is public policy will change behind it. What's your opinion around that?
Yeah, I think it's a great question. So from a policy perspective, I think there are several, you touched some of them. Indeed, the pricing, the market access part will be critical. You've got the regulation. So France is a lot of European countries are highly regulated countries, and they are very controllant in some way. You know, they like to control small things. They're micromanagement kind of countries. But in these situations, actually, it might be mandatory to do that so that everybody has access to it. I think the limitation for me is if we don't have enough supply. Because if there is enough supply, it's not a rare good anymore. So it's more difficult to pull up the prices. The situation we're facing right now is that the supply is really low, number one, well, compared to the need. And number two, it's all concentrated in one place, which makes it really powerful. For me, that's the limitation. It's the fact that it's all sitting in the hands of a couple of people sitting in a different country. So if we were able to, if every country, if I take back this mask, when everyone is able to do their own masks, the ones that you buy don't have the same value as if nobody was able to make their masks, you know? So, and the other thing, I think we should never forget that we vote with our dollars and with our euros. So if you can make your own mask, or if you can go to someone that can make you a mask for a fair price, or if you can support a local company that is doing the right masks, do that. Don't rely on the supply chains from other countries. And I would say the same for every good, you know, buy local. It's cheaper, it's better for the business. It's a little bit the same concept, you know? So for me, the limitation...
That's another learning from... Yeah, that's another
buy local.
From buy local.
Or DIY.
Definitely agree, yes. So, Rhym, we made the round of questions. Is there anything you would like to add from your practice, from your perspective?
Yeah, I think this crisis, you know, brought up a lot of anger, fear, stress. Reality is our standards are changing and are evolving. So our society will change. And actually, some people say we are already in the tomorrow's world. So you don't have to fear it. You have to embrace it. Just try to see the positive things. On the one hand, we see all these banks closing down, you know, and putting everybody over the phone, and you cannot get somebody to talk to you anymore when you have a problem with your card. But on the other hand, when I think of the situations where we don't have enough physicians in some areas, digital and remote can be a tremendous solution for those people who don't have access to physicians right now. So there is a good side and a bad side, but technology, we should never forget that technology is a tool, and we are the ones using that tool. Yeah. So, you know, the hammer has someone using it. We will see a change in healthcare. We will see a change in how people manage, how physicians manage. Probably we will see that a lot of things will disappear. Physicians will still remain important in diagnosing patients and making the exams. But I think this current crisis is definitely accelerating the transformation that has started 20 years ago.
And we're both agree that we will go through this Skyfall challenge and became faster, stronger, more adaptable, more creative, and more collaborative, right?
And more tech savvy.
Rhym, thank you very much, really, for this dynamic and interesting discussion. Thank you for joining me. Thank you, everybody, for staying with us online.
Thank you very much. Have a great evening.
Bye-bye. Have a great evening. Bye-bye. Thank you.